Hello, good afternoon, and welcome to today's Health Innovation webinar titled Heart Health Matters. My name is Cindy Yell, and I have the privilege of serving as the President and CEO of the Toronto Rehab Foundation within the University Health Network, often referred to as UHN. Before we get going, I have a little bit of housekeeping. I would like to take a moment to thank Bob Blakely and Liquorland Capital for sponsoring today's session. Bob is a steadfast supporter of Toronto Rehab and a strong advocate of the work and the message that we have to share with you today. I should let you know where we're beaming from today. We are actually in Discovery District. Discovery District is a 1 kilometer stretch along University Avenue that has one of the highest concentrations of scientists and health research taking place in the world. Our research hospital colleagues in Discovery District include Toronto General Hospital, Princess Margaret, Sick Kids, Sinai Health, the University of Toronto, and of course, Toronto Rehabilitation Institute. So a little bit of promotion for Toronto Rehab, a little bit of information. Many of you may not be aware of this, but we are a fully affiliated teaching and research hospital with the University of Toronto. In fact, over the last few years, we've garnered the reputation as the international leader in research in rehabilitation. You know, there aren't many organizations, public or private, in Toronto, actually, not even Toronto, in Canada, that can claim #1 status. But right here at Toronto Rehab, we can. One of our key research platforms is prevention. It's interesting, a hospital doing research in prevention, but it's true. For those of you that have had a loved one or maybe personally have been through a rehabilitation setting, a rehabilitation hospital, you would know that getting back to living your life is really hard work, and rehabilitation is a long journey. It takes one with a lot of fortitude, dedication, determination to get back to living their lives, and that's what we're all about here at Toronto Rehab. You may also not be aware that Toronto Rehab's cardiac rehab program is the largest in North America. I'm sitting here today with Dr. Paul O, and he's the director of the Cardiac Prevention Program and Rehabilitation Program here at Toronto Rehab. He also holds the Good Life Chair in Cardiac Rehabilitation. So today's session is intended to be interactive. We encourage you during the session to send us questions of myself or Dr. O. And we do have an email, I believe it's up on screen. It's TRF, which stands for Toronto Rehabilitation Foundation, at uhn.ca, excuse me. And so during today's 1-hour session, at any time, if you have a question, please forward it to us. And I believe it's the last 15 minutes or so, we will be fielding the questions. So that's it for me. I'd like to introduce again Dr. Paulo. He's become a bit of a rock star at Toronto Rehab and in fact across Canadian healthcare. So Paul.
Thanks very much, Cindy, and thank you to all of you for taking this time during your lunch hours or maybe afterwards to join us in this educational journey. I'll start by saying a little bit about our workplace. The theme of this is what can we do for ourselves or our workplaces to be a little bit healthier. And as February draws to a close, Heart Month, it's a nice time to remind ourselves that heart-healthy behaviors really should extend through the entire year. I have the privilege of working at Toronto Rehab Institute and the University Health Network. We engage with about 2,400 people every year who are recovering from heart events like a heart attack or heart surgery, as well as individuals who are living with diabetes or stroke or breast cancer. And we provide this kind of myriad, this composite that's shown on the slide, of healthy programs, including exercise, education, mental health intervention, stress reduction, healthy nutrition, lots of peer support, all with the goal of helping to recover from these catastrophic events, and indeed living lives well and living lives long with whatever condition one has. The important learnings from this sort of journey, though, is that we could really impact these conditions in another way. Not necessarily wait for the heart attack or stroke to occur, but rather move upstream and think about all the health behaviors that we can engage in to keep ourselves well over the long term. So in this presentation that'll go for about 40 minutes or so, we'll touch on these topics. A little bit of introduction about the burden of chronic disease. That doesn't sound very exciting, does it? But we'll try to make it interesting about why this is actually important, why this should be a burning platform for us. The connection to the importance of health behaviors in particular. And what are some ideas for prevention and management of chronic diseases that leads us to this core discussion around 10 health steps that we can take today. And what we'd like you to take away is simply a commitment to do one of these things. Just one, because the first step is the most important step. So a little bit about so we're going to refer to these terms on slides or in my conversation. I may call out this thing called CV, which refers to cardiovascular conditions affecting our heart or the blood vessels from our brain to our toes. And cardiovascular events you may see on a slide referring to heart attack, stroke, or death related to heart and stroke. Okay, so just in case you see those things. When we hear also this term called non-communicable disease, this is pervasive in Canada and around the world as a descriptor, an umbrella term for conditions that we are all living with. And indeed, many people in Canada today are living with conditions that affect our heart, whether it's a previous heart attack or hardening of the arteries, conditions like diabetes, where there's impaired metabolism in our bodies, cancers that affect our lungs, our breasts, other parts of our bodies, lung conditions, mood disorders, or arthritis as the common examples that affect us in Canada of these non-communicable chronic diseases. Why are they important? Because about 70% of adults today in Canada live with one or more of these conditions. So in fact, it's more common to have a non-communicable disease than not. These conditions are very costly if we think of healthcare budgets, and we'll see on this day when the new federal budget comes down and will undoubtedly pay some attention to health, part of that budget will be directed against how we cope with chronic diseases. A lot of what we do today deals with acute management of these conditions. And we should remind ourselves that it's not only medical costs, but incredible costs in lost productivity that all of us as employers deal with. And of course, the reason that 4 out of 5 Canadians die today relates to these conditions. So we really should pay some attention to these conditions. If we think about at the top of the tree where these conditions lie, we can spend a lot of time and effort, and indeed we do, and great programs and great hospitals and the community spend a lot of time working on these conditions. But if we do some reflection on why these things actually come to us in the first place, there are some fundamental health behaviors. Smoking, suboptimal nutrition, perhaps drinking more than we should, and inactivity are all at the roots of the development of these chronic conditions. So arguably, if we really want to have an impact on chronic disease in Canada, we should really be thinking fundamentally about our health behaviors early on in life. And 80% of Canadians, of course, live with at least one of these health behaviors. You can do a quick self-check right now. Are you getting enough of any one of these things, or is there some opportunity for change? In medical literature, we have lots of studies that talk about chronic disease and all the issues that may come around. But if we turn to some kind of public journals, and in this case the National Geographic, they ran this series a while ago about blue zone countries, the secrets of long life, and we can draw some inspiration from these sorts of stories as well. The residents of Okinawa and Sardinia, Loma Linda, California, for example, routinely people are living to beyond 100 years in these special communities. What is it that they know that we can learn from? Is it something in the water? Is it in the food, perhaps? Is it the way of living? And of course, it's all of these things. And the common attributes in these communities is that people live an active life. They eat mostly plants. They don't smoke. They really limit their alcohol intake. Importantly, there's a strong social network that goes through the community. There is stress, less stress that pervades one's life. And they have something called ikigai from the Okinawan community that is something that makes one's life worth living. It's important to have purpose, of course. So from these sorts of interesting observations, we can see the reflections into medical literature. And studies like this one, there have been many studies that looked at the relationship of health behavior to development of cardiovascular disease over the long term. And this is reflected on a slide like this that looked at about 70,000 female nurses and about 43,000 male healthcare workers. And the relationship that is shown here on the y-axis, the vertical axis, is the development or risk of cardiovascular disease expressed against the x-axis of number of healthy behaviors. The highest risk are those that do not have anything that's healthy in their lives. That is, they smoke, they eat poorly, they're inactive, they have higher body weight and poor body composition, and they drink too much. And that leads to a high risk of cardiovascular disease. But as you start to pick one of these things off, choose one health behavior in turn to start to make your health better, that you start to enjoy a reduction in cardiovascular risk. And indeed, about 80% of this risk can be mitigated by engaging in those fundamental health behaviors that we've seen in operation in communities around the world. It gives us a template that we should think about then as our 10 health steps that we can talk about today. Let's have healthy bodies. Let's manage cholesterol, have more fruits and vegetables in our lives, moderate alcohol consumption. Whatever our sugar levels, let's try to get them normal. Similarly, normalize blood pressure. Let's quit smoking, manage stress, get better sleep, and be active. And let's go through each of these in turn, if you'll follow me in this journey. So on healthy body composition, especially at the beginning of the year, there's often a lot of focus on weight, body weight, obesity. Indeed, some medical societies have called this out as a disease, a scourge of society. I think this is an unfair portrayal of the way that we are and the way that we're living. The process around weight management is much more important than what our body scales might say. The steps towards health are far more important than what is on the body scale. And arguably, if we were actually looking for a measure, if we want to look at that way, the size of our waist is actually much more important than the weight. And one important call out here, for instance, draws from a study that looks like this. So on the y-axis that should now become familiar to you, the risk of heart disease. And then we can look at that in relationship to levels of fitness in a population. Whether we are at kind of normal body weight by BMI categories, at least on the left-hand part of this slide, slightly higher weight in the middle, or higher body weights at the right-hand side of this. The important things for me is, if you look at the dark bar here, this group has the highest risk for heart disease, irrespective of what the body weight is. Similarly, within any weight category, as we become fitter, as we become more active, that risk really goes away. For me, it is far more important to be fit than whatever the body scale shows us. Fitness trumps the body scale, and it's far more important for us then to be active and moving at whatever body weight. And in fact, the scale can actually be very misleading in this regards. Number 2, perhaps you'll have a question about that and you'll want to submit. Question number 2 goes around cholesterol, and we're familiar with cholesterol as an important topic around heart health. This kind of orients us around the heart, and we're going to take a more detailed look at an inside of an artery, a coronary artery that's represented by the big arrow. This pathologic slide from a coronary artery that's gone bad. This is what happens when arteries go bad and cholesterol builds up. You'll see this large circle that represents the artery. The red area in the middle represents a blood clot that's formed inside of this artery at the time of a heart attack. The interesting part is the crescent moon that goes from about 4 o'clock up to 12 o'clock on the left lower quadrant of this slide. And that's where cholesterol has built up over decades of life. Sometimes we think about this as simply a static process. Cholesterol goes in, and once it's there, it's stuck. What we'd like to present, though, is actually this is not an inevitable thing. This is actually quite modifiable by the actions that we take today. And if this represents a different view of this kind of cholesterol kind of plaque in an artery, and this orientation is really that same cholesterol plaque in a living person, what's shown now, though, is an ultrasound image where the dark part represents the opening of that artery. The small circle in the middle, very center of this image, is actually an ultrasound probe that's threaded down a coronary artery at the time of an angiogram. It spins around and sends out sound signals that are reconstructed into this picture. The interesting part of this picture, again, is that crescent moon that spans 3 o'clock to 9 o'clock on this clock face, so to speak, and that represents cholesterol plaque or atheroma. The interesting thing now is, what if we decided to eat better, move more, take the medications that we might be prescribed to lower cholesterol? Over a period of 18 months, we can actually see the artery open up, the cholesterol plaque shrink by half or more, the plaque stabilize, so our risk of heart attack is decreased dramatically. In fact, people that can kind of follow this plan have a much better chance of living free of heart disease or stroke or other bad things happening to us. So we can reverse this. And if we think about some simple targets for us, if we are living with one of these plaques already, we would say, let's really push our cholesterol levels down. LDL is the bad guy. LDL, low density lipoprotein, or lousy for the L. We'd love to push this down as low as possible. And here's some simple targets for you to think about. If you're at higher risk, that is, you've already developed something in your heart, let's push it down and get below 2. If you're in the middle, it's about 3.5. And if you're living today, just out in society without any conditions, let's get that down below 5. So wherever you're at, there's a chance to modify this in a good way. And the simple steps that we can take can really make a difference on those pictures that might develop over the long term. Item number 3 deals around food. So we spend a lot of time thinking about food. And I'm very enamored of food as something that can be quite powerful in our lives. So this study that's called DASH speaks to individuals that might be living with slightly high blood pressure. On the audience today, there might be 1 out of 7 of us, for instance, that might be living with high blood pressure. Did you know that food has some important power in our blood pressure control? This study, that comes actually from about 20 years ago, but it's still tried and true, compared people in North America who were following a typical North American, quote, diet. That is, you eat liberally, you have lots of red meat, you have lots of salt, you don't have very much fiber in your diet. Let's compare that to some simple measures that we could take with our food choices today. If we choose to have more fruits and veggies and grains, less red meat, more fish, and more healthy fat in our diet, it's very interesting. Over a very short period of time, in this case only 8 weeks, we can see that there is a reduction in blood pressure by 11 points systolic, 6 points diastolic. That's actually a huge difference. That's as big or bigger than what we can achieve with any medication that we can offer you. That's the power of food in action. We know from large-scale trials that have been conducted in Europe and elsewhere that if we put this on a bigger scale, in this case with thousands of Spaniards, and randomizing them to kind of less healthy diets versus more healthy Mediterranean styles of diets, once again what we can see is about a 25% reduction, not only in blood pressure, but actually chance of developing heart attack or stroke or dying. Food is very powerful. By the way, in this study, to eat like a Mediterranean, 1 liter of olive oil was delivered to your house every 2 weeks. So have it liberally. Have more fat, in fact. Bathe in it. Do all kinds of exciting things, because that actually led to some really good outcomes. Which leads us, of course, to our Toronto Rehab style of eating. You know, diet is, in fact, a 4-letter word, isn't it? Diet, when it comes around in the new year, something that involves restriction and you can't have this, you can't have that. Diets actually, if you look at the origin of the word from Greek, really deals with a way of living. So we would propose a way of living that looks like this, that we would propose not diets that are restrictive, but here's a plan, a pathway, and we'll call it the F plan, that involves fruits and vegetables. And you can have them fresh or frozen, make them festive, make them fun, have lots of fiber as a result of that, have some more fish in your diet that will give you some omega-3 fatty acids, have some healthy fat like that extra virgin olive oil, and if it makes you flatulent, it's probably good for you, in fact. And if I was going to write a book, I would call this F It Up. Dr. O's F It Up diet, and you can ask yourself every meal, every time, is there an opportunity to F this up just a little bit? This is better with the live audience. I know that you're just in stitches on the phone. I know you are. But what we can do is just think about this. And I did this morning. I had a bowl of very plain oatmeal, and I chose to put some nuts and seeds and raisins. This is a real thing. Or if you got a plain bowl of yogurt, put in something to make it interesting. You can see that these are really effed up meals, aren't they? That's breakfast. What are you going to do with dinner time? On the left-hand panel, there's the typical Canadian thing where we have a lot of starch, rice and bread, and a little bit of protein. Gosh, what's missing here? On the right-hand panel, we can F this up really in a simple way. Put some green, put some red, make it fun, make it festive. You're getting the fiber. You're getting some extra good fats. Isn't this interesting? Challenge the kids at your table. You want things to really be effed up tonight, don't you? And every time you can do this, and gosh, you'll be better off as a result. Part of the Mediterranean plan, of course, involves some alcohol, doesn't it? As long as we're social about it, have a good red wine, some vino, with your meals. There is actually an interesting medical literature about this that will say many things have this complex relationship that's called a J or a U, and I think you can appreciate that. That in health, a little bit might go a long way. Too much is bad. And in the literature that deals with heart disease, for instance, for men, having about up to two drinks per day seems to be associated with cardiovascular benefit. For women, because they have smaller livers and less ability to metabolize in a healthy way, maybe 1 drink per day might be associated with cardiovascular benefits. But here's what I would ask you to take away from a slide like this. It does not justify reckless behavior, of course. It does not justify having the gin and tonic every day. What it does justify is that there probably is a healthy relationship we can have with alcohol. If you have some, it might be associated with benefit. There is risk, though, in having too much in terms of cardiovascular adverse effects, liver effects, all kinds of bad things that can happen. So if you do drink, have 1 to 2. If you drink too much, drink less. If you had to choose something, make it a red, make it French, make it exciting. And that's part of the plan. The next item deals with diabetes. And it's interesting, the statistics that are quite alarming that would suggest from Diabetes Canada that almost 1 out of 3 Canadians today are either living with full-blown diabetes or at high risk of diabetes, something called a pre-diabetic state. That means that there's about 3.5 million people today that are living with diabetes, and many, many people are at risk. The costs of care are extremely high as a result. It's interesting in my time as a internal medicine specialist working with people living with heart disease or stroke or living with diabetes that we've had a number of interesting conversations. And some of them say that, you know, given that I have diabetes, my sugar is high. That's what being diabetic means. And therefore my sugar will be high for the rest of my life. Where I find that kind of a startling sort of comment is that if I look at relationships in studies like this that look at the risk of heart disease versus the level of control, and one measure of control of sugar is this thing called an hemoglobin A1C, a 3-month average measurement of sugar. And no surprise that the lower our sugar is, the better we are off in terms of risk of complications for our eyes, our kidneys, our nerves, and indeed for our heart. And what I would say to that individual, very smart, learned individual that said, I have diabetes, therefore my sugar is high, and my sugar will forever be high, is that is not the reality that needs to be there. And in fact, if you're living with diabetes, normal glucose is the goal. If you're living without diabetes, normal glucose is the goal, because it makes a difference. And we need to normalize that sugar and avoid heart risk as a result. On the issue of normality, we can also think about this for blood pressure. Of course, everyone's had their blood pressure measured. And it's interesting that Hypertension Canada, the guidance body that deals with guidelines for this country, and the WHO, the World Health Organization, would all have these similar kinds of definition. High blood pressure means your pressure is higher than 140 systolic over 90 systolic. The question that then follows from that is, if that's high blood pressure, interestingly, then I guess normal blood pressure must be anything less than that. If I'm at 139 over 89, by definition, I don't have high blood pressure then. But what's interesting, if we look at trajectories of people that have slightly high blood pressure, slightly normal blood pressure and really normal blood pressure, those things are startlingly different. This prospective study, about 4,000 men in Europe, looked at this kind of question and said, if I have a blood pressure 139/89 that's showing the red line, high normal, versus what's called normal, 135/85, for instance, that's quite normal, versus optimal, 120/80, you can see the risk of stroke over a decade varies greatly. And in fact, the risk of stroke in the highest group is about 3 times higher than the optimal group. So you'd like to be not only normal, you'd like to be really, really normal. And if you're living with established high blood pressure, this study that just came out a couple of years ago also looked at this question. So we can give you medications, for instance, and good diet and exercise to lower your blood pressure. And if you reach just a kind of, you're sort of normal at 136 versus being really normal at 120, you can see that the risk over 4 years of having more bad things happen to you differs by about 25% in terms of cardiovascular risk. So get yourself to be normal, but be really, really normal with your blood pressure. Item number 7 deals with smoking. And unfortunately, smoking still, or tobacco control, is still an issue in Canada. We've made great strides over the last couple of decades, bringing down smoking rates from 30 to 25, now to about 20% across the country on average. You can see, though, that there are some hot spots in this country, and certainly in more remote rural regions, there's a greater prevalence of smoking. This is bad, right? We know that the single most important health intervention that we can offer to somebody who does smoke is counseling, advice, support, friendship, anything that we can do to help that individual become a quitter, because it makes a big difference over the long term. People in our program that are coming to us after a heart attack or heart surgery, if we look at the risk of heart disease over the next few years, no surprise that the people who are never smokers are much better off than those people who did smoke. The interesting thing, the magical thing that happens for me is that if we look at those people who are able to quit smoking even after having a heart attack, that over the course of 3 years, their risk actually goes down to approach the risk of a non-smoker. It is never too late to quit. And for those of you who are smokers, who have tried, congratulations that you've tried to quit smoking. We know on average it takes about 13 quit attempts. In each attempt that we've tried, maybe in January, and now we're smoking again in February, each one of those times where we've started and then stopped and then started again, I say congratulations, because that's one more step closer to actually getting to the quit. And we have to try a number of times to get there. For those of you who are living with a smoker, give them a hug and say, this is tough. Nicotine is the most powerful addictive substance that we know. It's tough to quit. Let's be supportive, and let's just keep going. It's never too late. Okay, we are all living with stress. If we were in a live audience, I'd ask the room, who has experienced stress in the last week? And I'd imagine it's all of us, because that's the way that we are wired. That's the way that we work. And stress can be a good thing. This is a phenomenon for all of us. This is a normal stress response, that we are exposed to something, whether it's work, whether it's physical, whether it's mental, whether it's something else, whether it's trying to get downtown in time to do a talk that you're scheduled to do. I had this experience today. Anybody went down the Don Valley today? It's interesting when it's a quarter after the hour. You have to be here at the hour, and the sign says it's going to take you 45 minutes to get downtown. It's a very interesting experience. So I experience this routinely. There's something wrong with my life. So when we look at that stress response, catecholamines, epinephrine goes up, adrenaline, cortisol goes up, all other kinds of stress hormones go up. But fortunately, if we're wired correctly, that stress response will go up and it'll come back down. We can learn from our furry friends in the animal kingdom, because if you ever had that experience of driving down the road and then a dog ran out in front of your car, you slammed on the brakes, didn't you? That was stressful for you and your furry friend. It's interesting, the recovery, though, that happens. For us, we will live on. That event will live on. I'm still talking about this event that happened 5 years ago with the furry friend, and I'll keep talking about it forevermore. I can turn that stress response and keep it going, whereas my furry friend will find a strategic spot to rest, to cool down, and the response is gone. They'll never think about it again. Humans, though, do you know anybody like this? They will develop a stress event, then relive it and relive it and relive it. I can tell you about this at lunch. I can tell about dinner. I'll tell you tomorrow at breakfast about the same thing again. And humans have this ability to turn the same stress event into repeated hits that then develop as mental strain. The bad side of this is that not only do we get an up and down in adrenaline and cortisol, but it stays up forever. It leads to things like high blood pressure. It leads to things like developing obesity. It leads to things like more diabetes. So only humans have the ability to do this. So stress is not the problem. It's what we do with the stress and by turning it into long-term strain. So think about that. It leads also very much closely connected to sleep problems as well. Many, many Canadians are living with some kind of sleep disorder. Actually, for people that come to us after a heart attack or stroke, if we actually do some specific measurement of sleep, and Toronto Rehab has developed some very interesting devices where we can do sleep screening in people just by putting a little microphone on your face overnight, we can actually watch what happens to people. Do you keep breathing? Do you stop breathing? Do you struggle at nighttime? Do your legs go crazy? Is there really disordered sleep? And in fact, about 70% of people that come to us living with heart disease or diabetes have some kind of important sleep disorder. The result of that, if you don't sleep well, your days are shot, your blood pressure is high, your risk of stroke and heart attack goes up. Your hearts actually struggle under that strain and they don't function as well as they do. In fact, they behave abnormally and can trigger all kinds of weird arrhythmias. If you're living with diabetes, your sugar levels are higher as well. So sleep is the thing that's meant to restore us. If we don't sleep, we're never restored. We're always on stress. We're always under strain. So think about that as something that we can do. Think about how we might actually improve our sleep hygiene as well. Are there things that distract us? Are there screens? Are there noises? Is there light that will interrupt with our sleep? There are some simple physical measures that we could take if we just get reorganized. And if you do think you might have a sleep problem, talk about it with your healthcare practitioner. Maybe there's something that can be done. Rounding out my top 10 is this. It's not necessarily this is the least important, but this is just where it sits in my list of top 10. Actually, I think this is the most important. So I've had this privilege of standing in front of you for the last half hour, which I really appreciate. And I'm glad because when I do these talks, I get to be active for it. So not only do I get to share some information, I actually get health benefit from this because all of you, unfortunately, have put yourself at incredible risk for this last half hour by sitting and watching this. Maybe some of you are standing, and that'll be a good thing. Here's some simple mantra: sit less, move more, and it's a really, really good thing. Again, if we look at medical literature, there's a great literature about this. There's hundreds of thousands of people that have entered into medical studies looking at the relationship of how much we move, how fit we are, how much we sweat on the x-axis versus what happens to us over the long term, developing heart disease or in fact dying. And there's this interesting relationship, and this is from a study of about 10,000 men, that shows that there is a curvilinear relationship. That is, the more we do, the risk of dying or developing heart disease goes down. That's a very exciting thing. So we can move, we can change our destiny, which is really, really exciting. The other interesting things on this graph that are apparent to me is, and should be apparent to you, the steepest part of this curve lies, I think you can say, is on the left-hand side of this, right? The first step is the most important step. At the right-hand side of this are my friends that like to do full marathons versus half marathons. Should I do that full marathon this year? Well, my risk of actually changing my destiny actually really doesn't change very much. I'm already super fit, and it's not going to change much more. I'll get more pain. I'll have maybe other benefits, but that's a great thing. For the Canadian population, most of whom sit at the very left-hand side of this slide, the first step is the most important step. And if we think about our workplaces, the folks in this room today told me they enjoyed the health benefits of walking from their workplace to this place. And that was a wonderful thing about changing health trajectories for today. First step, that's the most important step. So we can ask this question: are you getting enough? Are you getting the 30 minutes per day of moderate to vigorous physical activity? Are you getting a little bit sweaty, a little bit short of breath? And if you can't get 30 minutes all at once, can you do at least 10? and then add another 10, and another 10 at another time of day to get our 30s. This is the way that we can get enough, and maybe this is the opportunity that we can engage in today. If you haven't gotten enough, there's still lots of time, and this is a beautiful day to do it. Not only do we need to move, but we also need to not sit, because sitting is also a very, very dangerous thing. This article that our group published just a couple of years ago, my good friend and colleague David Alter was the senior author on this paper. He's the first and only chair in cardiac rehabilitation in this country. We did some analysis that showed that sitting is indeed a very dangerous thing, that sitting increases our risk of heart disease, it increases our risk of diabetes. In fact, it doubles it, increases our risk of cancer, increases our risk of dying. Thank you very much for agreeing to do this very dangerous activity by sitting through this session. This other analysis from a group in Australia said that even if you're an active, avid exerciser, we still carry this risk, and that watching TV can in fact be very deadly. If you follow me in this slide, on the left-hand side are people that actually are very active. They do an hour of regular physical activity per day. The red bar is the lowest risk in people that actually are very active exercisers, but they don't watch any screens in the course of their day. The gray bar is those who actually sit quite a bit and binge whatever it is that their favorite show might be, that they actually double their cardiac risk, even if you're an active exerciser. The very worst are those at the right side, of course, those who never engage in any exercise and who watch a whole lot of screens. Well, their risk is incredibly high, and in fact 4 times higher than the people who are active regularly and don't sit. So maybe this is something simple that we can do. And if we brought this home for you today in an office environment, one of my good colleagues in the UK conducted this experiment in office workers, and they changed the setup simply by doing this. For 1 week at a time, we'll ask people just to sit all the time like their usual condition, versus people that would stand for the afternoon, break up their days. And if we look at levels of sugar in the afternoon period of time, for people that would sit all the time and show the blue line, you can see their sugar levels go up after a lunch period, and they stay up for the next several hours after having a lunch. For those who are randomized to the standing condition, their sugar levels go down about 40% just by standing. This is what's in our control, and we can think about what we're going to do after our lunch periods. If you can't stand all afternoon because that's the nature of your job, at least if you break it up by getting up every 20 minutes, that's something that we can achieve, which is very, very interesting. So arguably, we would say that this is the most dangerous place at house or work. And it's interesting that if we were going to pull up YouTube and pull up an exercise video, I think you'll recognize the first thing that pops up on that screen for this exercise is, this is going to be very dangerous for you to do this chair yoga program. I think you should go consult with your doctor before you ever do this, right? That's the first thing that comes up. But yet we tacitly accept that for every chair that's in our environment, in our home or work, the last time I bought a couch, I did not see this warning sign. Please consult with your medical professional before you use this. This could be very dangerous for your health. Please check this out. Maybe we need to change society in this way. We've gone through a whirlwind of topics. If you want some more in-depth information about any of this stuff, our foundation has supported us, and our patients have supported us, and our sponsors have supported us to build these kind of assets. We'll invite you to come to our websites that are called cardiaccollege.ca and diabetescollege.ca to learn more about any of these things. You'll find more in-depth information, you'll find videos, you'll find animation that would be useful for you, your families, the people that you work with, maybe the clients that you serve, and we're happy and privileged to be able to share that information with all of you. So some summary ideas: that chronic disease is a real problem. The forest is growing very well, thank you very much. And if we really want to change the trajectory of health in Canada, think about the health behaviors. Mrs. Nishimura, who comes from Okinawa, believes in eating more plants and being healthy in her diets. Even Mrs. Nishimura will tell you, you really should F it up. So go do that. There are ways that we can build a healthier kind of risk program for all of us and make all those pieces fit together, manage blood pressure, manage diabetes, be healthier as a result. manage the stress in our lives. It's there. It's what we do with it that's the real issue. Sit less, move more. Thank you very much. We would welcome your questions at this point.
This is the first time we've ever taken this message and Paul live to the masses. So thank you for doing this. You're making a real difference. So I do have a number of questions that have come through online, and I encourage everyone, if you do have a question, please by all means send it to us and we will pick it up. So the first question is from Alex, and it is, to maintain cardiac health, how important is it to control high blood pressure, and what steps can you take to make your blood pressure normal?
Great. Well, thanks. Part of this could be a callback to the session. Did you learn? Did you listen? So high blood pressure is extremely important. Again, it's very common in our population. And there's some simple things that we've talked about today that if you move more, actually incorporate even some weight training into your program, you can cause blood pressure to go down by a few points. Remember DASH diet, so eat some more fruits and veggies, nuts and seeds, get more fiber, blood pressure down 11/6 points. If you do need medications, and many people do, take those medications regularly, and some people need more than one because each medication only does so much. Get the blood pressures down to optimal targets. Talk about it with your doc. See if 120/80 is right for you, and if it is, then that really changes the trajectory over the long term. Get your blood pressure in control, reduce your risk of heart attack, stroke over the long term. It's in your hands.
It's really, it's become quite holistic, the approach to maintaining heart health, improving your heart health, cardiovascular health, diabetes, and so on. It's really interesting how the shift is coming into medicine and just the community at large.
Yeah, I think through the efforts of great organizations like ours and many others, that we're trying to pay much more attention to the importance of lifestyle. You know, we've appropriately had lots of attention in our hospital systems around new medications, new interventions, new procedures, which are all outstanding. I think the message that we bring along is there's this other great complement to whatever we do. We can make it better by moving more, eating better, managing stress, all of these things. And they really do need to go together, as you say, Cindy, that we really need this holistic, whole-of-person approach.
That's great. So we have another question from Vanessa, and it says, Advil is a recommended medication for cardiac care. What are your thoughts about Advil?
Okay, that's an interesting question, Vanessa. Thanks for proposing that. I've got a couple takes on this. So if the question truly is about Advil or Ibuprofen, I think we're familiar with this as an anti-inflammatory medication. We might use it for headaches or joint pains or these sorts of things, and it works extremely well. The effect of this whole class of medications, though, on the heart is somewhat more controversial, that there are some studies that would say, in fact, taking too much of these medications over the long term may actually be a bit of a challenge for the heart. We know that if you take a lot of these medications, they can actually, while helping with pain, they can trick your kidneys into holding on to more salt and water, raise blood pressure, and as a result of that, may actually cause an excess heart risk. What it says to me is that we should always be cautious with any medication that we take. If you're living with a heart condition already, think about the interactions. And if you're taking a medicine like ibuprofen and you're already taking something like aspirin for your heart, then that interaction may not be the best because the ibuprofen can be tough on your stomach. And sometimes medicines may have unintended effects. Like, who knew that a pain medicine might actually cause your blood pressure to go up and cause other troubles? So we'll be cautious with any of these things. But thank you for raising that question about over-the-counter medications.
So we have questions really flooding in now. Okay, so Paul, we have a question from Alan, and it is 10 or 20 minutes of rigorous exercise preferred over 20 to 30 minutes of moderate exercise?
Great question, Alan. Thank you. And I think Alan's obviously a very busy guy. He's trying to get more out of the little bit of time that he has. And Alan, I think you're right in that there is a lot of interest in higher intensity training over shorter intervals. In medical lingo and in gyms, this is called HIIT, or high intensity interval training. And for some individuals, this may be the preferred way to go. That is, if you're stressing your system to high peak levels and doing them for short periods of time, that we can actually get arguably better cardiovascular benefit with a shorter total duration. So this may involve sprint work for the runners. It's going up and down hills or doing fartlek training, these kinds of things. Doing the spin class up and down. All of these things are great strategies. The caution that I would offer up, though, for people that might be living with chronic conditions, heart disease, diabetes, that sometimes doing these really high-level intensity activities out of the gate may be stressing our systems a little bit too much and may also cause injury that can kind of throw a wrench in our long-term sustained activities. What we would advise in our programs would be build up the base first, build up the training, strengthen muscles, develop the flexibility that we need, and then start to introduce those intervals. And it's very interesting, in our heart populations even, we're getting people with sometimes the worst compromise of their hearts to do this kind of training, and it can be safe and effective. So thanks for the question.
It's great. So I have a bit of a two-part question.
All right.
What are your thoughts on wearable devices like, and I'm going to say Fitbits?
All right.
That's first. And then the second part is Fitbit often encourages people to go towards 8,000 or 10,000 steps per day. Does the number of steps really make a difference?
Great. Thank you. So for disclosure, I'll show that I wear an activity device. Why do I wear one? So that in these sessions I could show you I wear an activity device. I also use it as a watch. So do these things really change health? And it's interesting, if one looks critically at the literature, there actually isn't a lot published about specific health benefits, like is your blood pressure lower because you wear one of these, or is your sugar levels lower? Not necessarily. The device for the right kind of person who has a goal, that's really where it's important. So if you're using it and looking at the steps and saying, I have a goal in mind of doing 8,000 or 10,000 steps, or getting my star today for doing 30 minutes of activity, or getting a star for my 10 flights of stairs, these might be good things because they're goal driven if you keep doing it over and over. And it's probably the act of self-monitoring against a goal that's really the important thing, and the device might help you get there. So that's what literature would show. Is there magic in the number, the amount? And there probably is. The number's probably around 8,000 for women, 8,500 to 9,000 for men who might have a strong or a longer stride length. And these are the amounts that correlate with about 30 minutes of activity per day that is associated with health benefit in populations. But I will say, if you're starting at 2,000 steps per day and you move to 3,000, that's great. That's the right amount for you, because the first step is the most important step, and that's where we should go. There might also be benefits if you want to go longer. So I have fun on weekends seeing, can I break the 20,000 mark or the 30,000 mark? I've yet to get my 40,000 badge, but I'm going to try one day. And those things may also have benefits. So I would say the step goal is a sliding one, and it's very individualized. But if you do have a goal and you make that progressive, that's a great thing to do.
That's great. Oh my gosh, I have so many questions.
All right.
How much? Hopefully we have enough time to get through. We have about 10 more minutes. Okay, keep sending them in. Here's a really great one.
Okay.
And I've not heard someone ask this of you before.
Okay.
Does getting enough sun, vitamin D, have anything to do with heart health?
Yeah. I love the question. So yes, sort of. How's that? So the literature about vitamin D and heart health is not as compelling as we would like it to be. I'm unaware of any very large-scale randomized trial that says vitamin D versus no vitamin D, that there's a benefit on cardiovascular disease. I will say, though, that of the food plans that we talked about, including effing it up, if you F it up enough, you'll get enough vitamin D in your diet, and that's just part of eating enough healthy food. Vitamin D deficiency is probably a bad thing for all conditions, including heart health. So there's those things. The other thoughts here, that of all the supplements that we might talk about, the only one that I really do recommend for Canadians is probably vitamin D, because we tend to be deficient in Canada, that we don't get enough sun exposure. By the way, did you know, Cindy, what the right amount of sun exposure is?
Oh. No, but
No.
I do take vitamin D.
You do take vitamin D? So one question would be, it depends on how much skin you expose. So on average, a Canadian needs about 13 minutes of direct sunlight to get sufficient vitamin D. So on a day like this, if we're out for 13 minutes, but if we're all covered up, which has been the tendency because we want to protect our skin. So if we're covered up and we have sunscreen on, then 13 minutes may not be enough. So here's my advice. 6 minutes naked. That's the way to go, but no more than that. If you don't get enough naked exposure, then take a vitamin D.
Even in the winter?
Why not?
Even in the winter.
Winter, you'll need more exposure, but that creates other hazards,
Okay,
Cindy.
I have two kind of add-on questions
All right.
related to vitamin D. Complexion. Does that matter in terms of the amount of sun that you
Yes.
should get?
So in terms of sun exposure to convert our vitamin D into a more active form, fair-skinned people might get more sun effects, certainly more risk for burning as a result of that. But I think pragmatically, I think it all hangs together, right? So if we're active every day, outside every day, getting a 30-minute walk in every day, we're probably going to get enough sun exposure, vitamin D. In the wintertime, the angle of the sun really doesn't give us enough radiation per se, so getting supplement through the wintertime is probably still a good idea.
Okay, and for those people like me that actually take vitamin D every day, is there a suggested moderate amount?
Yeah, for most adults, getting 1,000 units a day is really reasonable. There are some who might be very deficient that might take much larger amounts. So between 1,000 and 2, some medical groups would suggest if you're living with some kind of inflammatory condition, arthritis, skin condition, bowel disease, that maybe you'll need more than that, like 4,000 or 5,000. But chat about it with your doc about your particular condition, your situation, about how much might be reasonable for you.
That's great. I just a shout out to Joanne for that vitamin D question, the sun exposure question. Really great one. And again, I haven't heard that one asked. So great, thank you. We have another question. If you are at high risk of a cardiac condition but make the necessary behavioral and lifestyle changes, how quickly can you reverse your chances of a heart attack?
That's a very interesting question. So can I turn my high risk into lower risk, and how long might it take? Well, it's interesting. So I think you can actually achieve some important changes in a relatively short period of time, like months. We know things like fitness drive our cardiovascular risk, and within a few weeks we can start to see important changes, like within 8 weeks of your fitness levels really, really going up. We see from the blood pressure studies, say with DASH diet, that within 8 weeks you can drop your blood pressure quite dramatically. If we're looking to change the architecture of those arteries, it might take a little bit longer to get cholesterol out of arteries, and we've seen those studies typically last several months in time. But, in the short term, we can actually start to see some important changes. So if you're at high risk, do everything that you can to change something now. Sometimes it seems overwhelming, though. Man, they want me to fix my blood pressure, my diabetes, my cholesterol. Suddenly I'm on from no pills to 5 pills, and I got to change my diet, etc., etc. So sometimes the piece of advice I would offer is, faced with many options, do at least one thing today. And start from there and build from that success.
And really, today's session is just to get people thinking about their own health and well-being, right? And our goal is, if you can make one change, one small change, I think our time and our effort has been worthwhile.
Absolutely.
Okay, so some more questions. Hereditary factors. Can you talk about that?
Yeah, absolutely. So family history, particularly heart disease, is an important issue. There is no single gene that drives the risk of heart disease. It's a complex thing. There are genes that are associated with high blood pressure, genes that are associated with diabetes, there's overlap in terms of risk of heart disease. We know that a strong family history may actually double your risk of developing a heart condition down the road, but certainly not inevitable that the genes we inherit are not the destiny that will happen to us. Indeed, sometimes you'll see even in twin studies that one twin might actually have problems, the other won't, and sometimes in our lives we know twins this way as well. So genetic factors are important. We do inherit potentially things that will give us a tendency towards heart disease, diabetes, hypertension, but we can modify our environments in a big way as well that will mitigate that risk largely.
So I think we're nearing the end here. It's not just about maintaining a healthy heart. It's about feeling good. And I think that the tips that you've shared with us today, and you've shared on many occasions, are really about living your life to the fullest, right? It's not just about the heart, it's about your whole outlook and your well-being. So any last messages to our guests that are online? And I believe this is actually going to appear on YouTube kind of as a feed moving forward, probably within a day or so. But any last messages to the crowd out there?
Yeah, so I'd really love to echo your point, Cindy, that, one, it's our privilege to be able to do this for you, share some health tips, and I would encourage, not only are we sharing some thoughts, but here is a little bit of call to action for you and the people around you of picking the one thing, picking the thing that's most important to you. And it needs to be very personalized, right? So for us to say everyone must get active today, if that's not important to you, then do something else. But do one thing, please, and do something, one thing with a family member and friend. If we want to live long and live well, then this is the way that we're going to get there. An ounce of prevention, pound of cure. People have talked about this for centuries, and we're just coming around and learning this in medicine. So thanks for sharing in that message, and thanks for joining us in this journey.
So I'm just going to close it out. Thank you again, Paul, for sharing your wisdom and expertise and experience with all of us, including the people in the room and, again, those online. As I mentioned, we will have this session appearing on YouTube and on our website, which is www.torontorehabfoundation.com. You should see it there within the next day or two. If you haven't already, please follow us on Twitter. Again, it's Toronto Rehab or Toronto Rehab Foundation. There's a lot of great health information on there, including, again, this presentation. And as I mentioned at the start of today's session, Toronto Rehab has what's considered the #1 research enterprise dedicated to rehabilitation in the world. And so we often open up the doors to our research labs. They are out of this world. It's like a Star Trek scene, simulators and such. And you'd be shocked, actually, what's underground along University Avenue, kind of, again, from Dundas to College, flanking both sides of University Avenue. We encourage you to come check us out, see what we're all up to, and I think you'll be inspired. Certainly, Paul is one of our rock stars, as I mentioned, but we have many others too. So we will be sending out a survey at the conclusion of today's seminar, which is just a moment away. We encourage you to fill it out and give us your feedback. We do many of these sessions. We'll continue doing them online. We do them live as well. But tell us what you want to hear. Tell us if this session was worthwhile to you. Tell us if we were able to motivate you to make just one small change. And I think on that note, I want to thank everyone here. I thank Jennifer Huang and Arlene Boyce and Henry Zajac, who were the chief coordinators of today's session, the studio here at Toronto General for hosting us. And of course, Paul, thank you so much for your time and expertise. It's really a privilege working with you.
Thank you.
Have a great afternoon, everyone.